All right. 2 hours after eating unknown mushroom, guys, mushroom, a 28-year-old man sensed a decrease in his mobility, deterioration of his ability to focus. The condition was then followed by a state of agitation and aggression. On examination, he is disoriented, his speech is illegible. 4 hours later, he developed, guys, this is your clue, fetohepaticus, fetohepaticus, and lost his consciousness. What syndrome? Guys, fetohepaticus is also known as uh, hepatic, is it fictor? Yeah, hepatic fictor. Or let me just say the breath of the dead. The breath of the dead. So you see, the breath of the dead, how, just like we were talking about a problem with a liver failure. I believe you remember. When we talk about the liver failure, when we talk about the liver failure, we talk about what? That sound and that scent, smell you hear from the mouth, or I mean you sense from the mouth, not you hear, you sense from the mouth, isn't it? So that could also be there. Fetohepaticus could also be there. Okay, so again, fetohepaticus has to do with the problem with the liver. Okay, the liver. It is seen in a portal hypertension. It is seen in portal hypertension, and usually it is a sign in a liver failure. It is a sign in a liver failure, and again, it has features of hepatic encephalopathy. Again, when this thing is present, it means that the heart cannot really do much. I mean, sorry, the liver cannot really do much to remove harmful substances or detoxify harmful things inside the body, isn't it? So as a result, the brain gets affected and it starts having what manifestations, isn't it? Because brain doesn't like toxic stuff. So if these toxic stuff are not taken out, they affect the brain, and that can lead to what? A problem, isn't it? So what are we looking at over here? We are looking at what? A problem with what? A liver failure. Liver failure. We're looking at a liver failure. A liver failure. So here, your answer should be what? Acute hepatic failure. Yes, I mentioned portal hypertension because when there's a liver failure, definitely things or movement from the portal section or portal vein, hepatic portal vein, will also be impeded, and that can lead to what? Portal hypertension. So portal hypertension is a consequence of what? The fetohepaticus, okay, or a liver failure. Let me put it that way. So your answer is hepatic failure, not portal hypertension. All right. A 36-year-old man complains of marked dyspnea, so lung problem, cardiac pain. Okay. He ascribed his disease to a case of influenza that he had 2 weeks ago. Objectively, he leans forward when sitting, at least to help him breathe, isn't it? The face is swollen, cyanotic, cervical veins. Guys, look, cervical veins are distended. Heart borders are extended on both sides. Heart sounds are muffled. Heart rate is 118. BP is 90/60. ESR. ECG shows low voltage. X-ray shows trapezoidal cardiac silhouettes and signs of pulmonary congestion. Guys, you see again, pulmonary congestion. Cervical veins are distended. Jugular veins. Again, it tells you that the heart, there's too much of what? Fluid inside the lungs. So blood that is entering are not even entering to the lungs because they are now regurgitating, isn't it? So what could be that? So that means that it could be what? A fluid inside it. And the person has told that he had what? A history of what? How do you call it? Influenza. Though that does not really play a much role, okay? However, for us to have a pulmonary congestion, that's accumulation of fluid inside the lungs. This is what is resulting in impaired perfusion or, problem with what? Exchange of gases. And that is why over here, you need to do what? A pericardial tap to remove the fluid or to drain the fluid. So you do what? A pericardial puncture. pericardial tap, anyhow you want to pronounce it or you want to use. So that's what we're going to do over here, so that you can what? Reduce the volume. Hey, that's a volume. Reduce, yeah, reduce the amount of the fluid so that the patient can what? Breathe properly. So here we are looking at what? An A. We're looking at A. We're looking at A. All right. A 39-year-old man suffers from chronic rheumatoid heart disease. Again, when I mention a disease, start looking at what? The consequences or the complications that might arise. As simple as that. Medicine is so sweet. Medicine is so sweet. Now, he complains of dyspnea during physical exertion, cough with expectoration and palpitation. Auscultation detects intensified first heart sound and diastolic murmur. The sound of the opening mitral valve, guys, the sound of the opening of the mitral valve can be auscultated at the cardiac apex. The second heart sound is accentuated over the pulmonary artery. The patient is cyanotic. X-ray shows dilated pulmonary root and enlargement, guys. Enlargement of the right ventricle and the left atrium. Look at it, oh. Right, not left ventricle, right ventricle and the left atrium. What is the most likely that, guys, we'll talk about this. If people are having rheumatoid arthritis, definitely you're thinking of what? Mitral stenosis. Guys, we've done this. You are thinking of what? Mitral stenosis. Secondary to rheumatoid fever. Secondary to rheumatoid fever. You are thinking of what? Mitral stenosis. And again, now the reason why I underline this right ventricle and left atrium. Look at what now when the mitral valve, what is supposed to send, fluid, or let me say blood, to the left ventricle. When that place is narrowed, do you think blood can go there? Of course not. Of course not. So the left atrium will be enlarged. And when the left atrium is enlarged, again, everything will be going backwards. So start thinking about it again. Backwards. Everything is going backwards. So when it goes backwards, the heart will become what? Congested. When the heart is congested, what happens? The ventricle, the pulmonary artery. Pulmonary artery will also be affected. When pulmonary artery is affected, what happens? The right ventricle will also be affected, because now the blood cannot move. So everything will become what? Backwards. Everything will become what? Backwards. So please, you need to understand some of these mechanisms. Okay, understand the mechanism, and that's what this word. The second heart sound is, that means it's increased over the pulmonary artery. Why? Because of congestion inside the lungs. Congestion because of what? The stenosis. I love medicine. I love medicine. I love medicine. This is B, guys. This is B. Medicine is just good. It's just good. A 23-year-old man complains of a severe pain in his left knee joint. Severe pain in his left knee joint. Objectively, the left knee joint is enlarged with hyperemic skin, painful on palpation. Complete blood counts. There's blood, hemoglobin, leukocyte, platelets, erythrocyte segmentation rate, bleeding time. Now, you could hear that platelet count is quite normal. It's quite normal. But look at the bleeding time. That's Duke's, according to Duke's method. Bleeding time is 4. Leukocyte coagulation time is 24. Partial thromboplastin time is 89 seconds. Rheumatoid factor is negative. What is the most likely diagnosis? Already they've told you that rheumatoid factor is negative. So forget about rheumatoid arthritis. Technically, forget about what rheumatoid arthritis. Now look at this boy. This boy having problem with what? Bleeding. That's the reason why they are giving you all these values. Problem with the bleeding. Problem with the bleeding. So again, let me give us a task. Let us find the normal bleeding, Duke's method, bleeding time, the leukocyte coagulation time, the partial thromboplastin time. Let us find out the normal values and put it at the group H. Let us look for the normal values. This is an assignment for all of us. Let us look for the normal values and put it inside the what? The group for us to all what? Learn from it. But definitely there's a problem with what? With bleeding. Problem with bleeding. And the person is bleeding through the joint. That's what they told you, that there's pain in the joint and this what? Hyperemia. It's when there's bleeding inside. That's why the place become what? Reddish. 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 So over here, you are don't go and say thrombocytopenia because platelet numbers are quite okay. In fact, it's normal. Usually it's about 140, 150 upwards to 400, if I'm correct. So over here, we are looking at what? Hemophilia, a bleeding disorder. Hemophilia. We are looking at hemophilia. Hemophilia. So here, your answer should be what? Should be A, hemophilia. So that means there could be a problem with the clotting factors. Clotting factors. All right. We have a 24-year-old woman in a 24-year-old woman, a kindergarten teacher, okay, has been sick for 2 days already. Disease onset was acute. She presents with elevated body temperature up to 38 degrees, pain attacks in her lower left abdomen, liquid stool in small amount with blood and mucus admixtures 10 times. Guys, we've discussed this already. 10 times. So don't confuse this with, of course, this is what? A dysentery, isn't it? But again, dysentery is different from what? Salmonellosis. Dysentery is actually the same as what? Shigellosis. Shigellosis. And one of the classic feature between shigellosis and even ulcerative colitis that you guys normally like to compare the two is the fact that the diarrhea here is massive. It's massive. So, and because it's massive, you seek for medical attention immediately, isn't it? You seek for medical attention immediately. So you will not end up having severe weight loss. But in colitis, you end up having what? A severe weight loss, because though there's diarrhea, but it's not that severe that will prompt you to want to go and visit the doctor. You might think, oh, this one it will go. Let me just drink water, it will go. Let me just take ORS, it will go. Before you realize you have lost weight, and that's not because of cancer. It's because things are going out of the body gradually, isn't it? In fact, both of them occurred on the segment colon. I mean, can happen on the segment colon. So don't use the segment colon as a way of differentiating between shigellosis and colitis. No, they can all be there. So over here, the number of times the person is having the diarrhea. That's what we are looking at. And again, all of tank is moist, coated with white deposit, abdomen is soft, blah, 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 blah. What is the diagnosis? Definitely, we're looking at what? Shigellosis. We are looking at shigellosis. All right. A 26-year-old man complains of chills, rhinitis, dry cough, and fever up to 38. Examination shows him to be in a moderately severe condition. Okay. Small, pale, pink, non-matching spots on the skin of his back, abdomen, and extremities. Palpation reveals enlarged occipital and axillary lymph nodes. No information about vaccination. What is the likely diagnosis? Because even if you don't know, I've talked about something over here before, like there are some 3 C's you need to look at when you're dealing with measles, right? I'm not saying this is measles, but there are some 3 C's you look at when you're dealing with measles. That's what? Coryza, coughing, and what? And conjunctivitis, yes. But over here, this is not a typical measles, but this is a German measles. German. You know how to pronounce it. German. The same thing. German measles. And German measles is also known as what? The Rubella virus. I mean, it's caused by what? Rubella virus. But the disease is what? Rubella. And again, they've told you that this person has what? No vaccination. So definitely, you are looking at this as what? A Rubella. caused by the rubella what? Virus. Rubella virus. And usually it looks more or less like measles, but it's not really measles. Okay. It looks more or less like measles, but it is not measles. So basically, and again, I mean, in over here, uh, how do you call it? In measles, the rash is not as in German measles. The rash is not as a reddish or as bright red as in measles. Let me put it that way, as in measles. Okay, so please take note of some small little differences between them. So over here, the answer is what? Rubella virus. Rubella virus.